The CDC says the risk of bird flu spreading to the public remains low, but they're asking health departments to be prepared. It comes following a reported case of avian flu in a person who had contact with dairy cows, presumed to be infected with the virus. Joining us to talk about our health headlines, it is Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doctor, great to see you. This is a little bit confusing because it's called bird flu, but this farmer presumably got it from his cows. What's going on here?
You know, it is confusing because I think when a lot of us think of influenza or flu, we think of that seasonal disease that starts in the fall, goes through the spring. This is very different. There's actually an avian version of influenza, predominantly affects birds, namely wild birds, but can infect other animals, cows, seals. There's a few other mammals. Rarely does it actually infect humans, though. It's actually quite rare. I think there's only been 2 cases in the United States. In general, at least our experience in the U.S. with the cases that we've seen, it doesn't cause severe life-threatening diseases. We do have ways to treat it. There's antivirals that can help. It is a really big deal for the poultry industry where it can wipe out, entire stocks of chickens at some of these poultry farms that we've seen, in recent past. But for the most part, not a huge concern for human beings.
I thought it was interesting, like even cows can be treated with this. So even the cows that got at this guy's farm, those can be treated. But yeah, there's lots of things out there if we get it. The big deal here is that we just haven't seen bird flu go to humans all that much, right?
Exactly. So, what we worry about, and this hasn't happened, but, could bird flu mutate, kind of like COVID can mutate, and could it become more pathogenic to humans? And will we have another strain of influenza that we need to worry about? That hasn't happened yet, but certainly you can see the concern on behalf of health authorities just to make sure we keep an eye on that so we don't see more transmission of bird flu to humans in the future.
And we always want our health departments to be ahead of the game, not behind the game. So that's where the warnings are coming. All right, let's talk drinking here a little bit. A new study says the number of people who drink alcohol who are 65 and older, that is rising, and that could have negative consequences.
It could. It used to be we would say, a glass of red wine is good for the heart. Recent data would suggest no amount of drinking is good for you. We may enjoy doing it. It's not good for us. This looks at increased drinking in those over the age of 65. A few reasons this could be happening. This could be related to baby boomers, a greater proportion of the population getting older. But there are a few things that older people need to keep in mind when they're drinking. One, the enzyme that metabolizes alcohol that keeps you from getting really drunk, you get less of that as you get older. So a smaller amount of alcohol can have more cognitive effects. And then you can imagine as we get older, our bones aren't typically as small or as strong. If we drink and we have falls, we lose our balance, more prone to fractures and other things that can be really life-altering. So just kind of a message to make sure that if we're drinking as we get older, we're being careful to do that in moderation, and we're being very careful about some of those things that happen as we get older and how alcohol makes them more likely to happen.
Well, we got like 30 seconds here, but Relievrio, an ALS medication, is being pulled from doctors' offices and the shelves. What's going on there?
Yeah, this was a controversial one. It was approved a while back on a very small phase 2 study that showed maybe some mild improvement in the treatment of ALS. It didn't really meet the rigorous standards that the FDA usually has, but there weren't many treatments out there for ALS. A large study was just completed. It showed no benefit compared to placebo. The company has pulled it from the market and is working on a way to maybe transition people who are on this medication to something else or at least off of it.
We talked drinking, medications, and bird flu. You are a man who is an expert on many topics. Dr. Jeff Pothof from UW Health. Appreciate your time.
Thank you.